Well, as we're talking about the challenges related to behavioral health, could we talk a little bit about what's going on in the hospital setting, specifically in emergency departments? If we go back about 10 years, ED visits, about 5% of those were behavioral health related, and now we've got 20 to 25% of hospital emergency department visits that are behavioral health related. Talk a little bit about what's going on and what we're seeing happening here in California and nationally.
I'm about midway through a tour going through different counties in the state, and there are lots of differences as you cross the state, no surprise. But there's some themes that keep coming out, and one of the most profound is the issue of emergency room boarding and crowding, specifically for behavioral health. Not entirely, but partly driven by the increased number of young people who are showing up in the emergency room with suicidal ideation, suicide attempts. Nationally, that number's up 92% between ages 12 and 17 from 2007 to 2015. So we have every reason to believe that it's continued to climb since 2015 or when the study stopped. So it's a pretty extraordinary moment where we are seeing more demand, and the problem is we have less capacity, and not so much less capacity in the ER, but there's just no off-ramp. There are no beds. I was in Redding, California a couple of weeks ago. If a kid needs a bed for psychiatric hospitalization, he or she goes to Riverside to get care. So there ought to be a better way, and part of it is just lack of capacity. We don't have the beds for kids. We don't have the beds for adults, and it's a system which has been evolving for years with fewer beds in the public system every year. Of course, more people being treated in the criminal justice system than in the public system. That's true in virtually every state in the union. As you know, there's something like 10 times more psychiatric patients, people with serious mental illness, in the criminal justice system than in the public mental health system, hospital that we have.
So could you unpack the capacity issue for us? Because there is physical capacity, beds, and then there's human capacity. Both the specialists as well as the community folks we need to actually care for people with behavioral health needs. We've got places, as you just said, in this state that are behavioral health deserts. Talk a little bit about capacity and where you see some of the mismatch.
Yeah, it's a great way to say this, Carmela. I think it is important to sort of distinguish between the physical needs. So we do need beds, but it's much more than beds, right? Even on the physical side, there needs to be a whole continuum of care. There needs to be the step down. There needs to be the opportunity to provide intensive outpatient treatment. Some of these things are not being covered currently by Medi-Cal, and we should be thinking about with a waiver opportunity whether those are resources that we can build out with some help from the federal government. The workforce issue that you mentioned, massive problem in California, and this is a place where I think we are reaching a crisis.